All right. So legislative process, I will say sometimes there's some people that find this stuff really, really interesting, others less so. It is really important information. We'll highlight why it's so important for all of us to understand the legislative process and how important it is. So here's our objectives. We'll come back to them. So it's really important for PTs and PTAs to be involved in the legislative process because we are the experts of the profession. We are the ones who work every single day. We understand the profession better than anybody else. And when we have our lawmakers who come from all sorts of different backgrounds, non-medical, and even if you're medical, you might not really understand the world of PT. Yeah, it's up to us to create that voice and to educate everybody that's possibly involved. How many laws have we talked about so far in this semester that impact physical therapy? Give a ballpark. Yeah, more than five is probably a good number. I think we talked three or four different ones last week alone. And then we talked about the Practice Act, that group of laws that govern each state has its own. So yeah, we've talked about quite a few laws. Well, imagine if people who weren't educated in the field of physical therapy were the ones making all of those laws. How do you think that would work out? Pretty terribly, right? Um, so really important for us to lend our expertise at a minimum. Also, protection of our Practice Act. That Practice Act is again that state individualized. Each state has its own Practice Act. That group of laws that governs the profession for that state. It's important for us to protect it, and other professions try to take things from our Practice Act and say, no, we do that now. You guys don't do that. So it's important for us to make sure that our Practice Act stands whole. And then big thing, advocating for our patients. And I think when we will go back, when did we go over? We did it a few different weeks, but all of the ethical guidelines from the APTA. I think that was like week 3, we might have talked about it. Then we did it in depth in weeks 4, and then we touched it again a couple of weeks later. I think I could be wrong on the exact weeks, but something like that. So we've talked about that a lot. And one of the recurring themes of that is addressing the health needs of society, right? And that's a really big thing that we've got to take ownership of. But when there's laws that impact our patients, we need to lend a voice to. Not only to advocate for laws that benefit our patients, but also advocate for standing against laws that will harm our patients. Insurance coverage is a great example of that. Huge problems with insurance coverages and why is insurance allowed to do it in this way? How are you? Good to see you. Make sure I grab you before you leave. Thanks. So yeah, I mean, we've got insurance coverages, man, there's so many laws. I let's just tell more about this. I was just talking with our legislative liaison at the APTA, the last meeting I was with, and all of the work he and a group of people are doing to try to change insurance coverage for physical therapy. A lot of the things that we talked about before, how insurance companies can do capitation, different capitation methods. You only have so many visits per year or so many dollars amount. Another thing, the one that we're really working hard on right now is prior authorization, which is a huge pain, where we have to get insurance approval before we start seeing that patient. It adds a ton of administrative burden. It adds a big lag time because the insurances don't, even if we submit for visits right away, they don't have to respond to us promptly. So now I've got somebody with a problem. And now, because of administrative paperwork on the insurance end, that person's not getting care for days or weeks on end. So there's a huge problem with that. There's also a copay equity problem. You know, if I want to see my patient twice a week, insurance all of a sudden starts saying, well, you're a specialist. So that patient now has, instead of just a $10 copay like they would at a primary care provider, because you're a specialist, it's a $100 copay every single time they come to see us. How many visits do you think a patient would come and see me if their copay was 10 times what they're expecting? Not a lot, not a lot. There's a big sticker shock, even if it went from $1 to $10. I was expecting $1. It's a big problem. Different equitable treatment and other advocacy efforts. I think addressing the health needs of society can also be environmental impacts. Common topic in Providence, you guys ever see the last few months there's been a handful of fires at the scrapyard, the metal scrapyard around right near the Providence campus. Huge environmental impact, huge health impact for the patients that live in those neighborhoods. When you look at asthma rates alone, asthma rates are higher in areas of poor air quality. So yeah, other advocacy efforts could include all things like that, just general health. Those are different ways we can advocate for our patients. So 4 different types of legislation: a bill. That's a proposed law that must go through the full legislative process before becoming legally binding. Talk about that process in just a little bit. A joint resolution is similar, but used for more specific purposes, like proposing amendments to the Constitution or addressing urgent matters. The 26th Amendment, which lowered the voting age to 18, started as a joint resolution in Congress. Concurrent resolution used for matters affecting both the House and Senate, but does not carry the force of law and does not require the president's approval. So condemning human rights violation. These are more, I'll say, ceremonial. We're all stand against this. We all stand for this. This was a great thing. More ceremonial. And then resolutions are ceremonial, used to just express the opinions of a single legislative chamber, either the House or the Senate. So passing a resolution honoring veterans or a famous figure who passed away. Every now and again, you might see there's a little league team that makes it to the World Series, and then this is local government. This is what I'm talking about here is federal, but the local government analogy is it's Cranston Little League Day, and right, we've declared today Cranston Little League Day. That's the resolution. It's like a big celebration. It's an acknowledgement, things like that. So Congress is comprised of the House of Representatives and the U.S. Senate. The legislative process is not easy. It is not easy to get a law passed. This is federal. We'll talk about state as well. But the process is very similar. So first, the bill is assigned to a committee and then probably a subcommittee within that. There's markup sessions. So, I could go and I could grab my local congressman or senator. Again, this is, if it's federal, I got to grab Sheldon Whitehouse or Jack Reed or someone, either the House Representative or the Senate. Say, I'd like this bill, they'd have to write it. And then that bill would be assigned to a committee, subcommittee. And then the markup sessions are, I don't like this word. Should be over here. Let's actually add this section of the law. Because maybe there's some language that really is important to physical therapists in the Northeast, but in rural areas of the country, it goes against what they need. So that's what the markup sessions are for. Like, how do we make sure this is a good binding law? An easy example would be how much supervision is required for PTAs. So if we're going to change the law, and that's Medicare, Medicare follows federal law. Here in the Northeast, it's not all that hard. But if you're in a rural area, middle of the country, bigger states, even places like Maine, it's a lot bigger than Rhode Island, and especially with how rural it is, it can be really difficult to travel around. Different supervision levels of PTAs can be really burdensome. So how can that happen? So once after the markup sessions where all the editing happens, the bill is rewritten, amended, the subcommittee then reports favorably, unfavorably, or the other thing is table the bill. Table the bill means we're not going to vote yes or no on this. We're not going to approve or vote. We're going to put this on the table and that's just a method to let it die. Actually, we'll get a little bit into it, but if you're trying to create a law, it's better to have your bill tabled. If it's not going to pass, it's better to have your bill tabled to then edit it and try it next year rather than have it be voted on favorably. If it gets voted on favorably, that's kind of the end. So that's kind of just like kicking the can down the road. Try it again next year. So after the subcommittee, if the subcommittee reports favorably, then the bill is sent back to the full committee for review, and then it's put on the calendar to be presented in other bills, so then the full Senate or Congress can vote on it. So here's the basic flow chart of that. Now, in the markup sessions and subcommittees and committee meetings, there's also hearings, potentially. Most of the time there are. And that's where people from the community get to go in and speak about the bill for or against. In the state side, the really hot topic recently, where there was a group of, maybe there was just one, but I thought it was a group of gun legislation laws that were being introduced. Pretty heated on both sides. There's some people that really don't want legislation that restricts gun access and Second Amendment, and there's other people that really want it. So in these hearings, the president of the Rhode Island chapter of the NRA would be able to talk intelligently about the way this is phrased. This is what you would actually be doing. So if you're trying to limit this type of gun, the way that this phrase would eliminate all of these others, and these are the kind of things that we do use to hunt if hunting is legal in Rhode Island, all of those things. And then you would also hear from the opposite side saying, this is not what the founders were thinking. The founders were thinking muskets, and now we have these other things. So you would hear from all sorts of sides. You also is the business owners, the firearm shops say you would be, if this was one of the popular things in the gun legislation that just happened in Rhode Island is, I own a gun shop. This is my most popular thing that I sell. This is my highest inventory. If you take away this inventory from me, I am probably going to go out of business because this is 30% of my sales and I only have so much profit margin. So all of those kind of things would take into place. So that, and in the physical therapy world, that happens all the time too. We want decreased supervision. I'm just making this up, but we want to loosen our supervision standards for PTAs. Well, the other professions would be able to jump in and say, well, we have this type of supervision for our CODAs, our PAs, our nurse practitioners have to be supervised in these ways. You would be giving the physical therapy more autonomy, more freedom than what we have. So why would they get more than us? So all of those kind of conversations would happen in those hearings. And it's not a cut and dry thing, but an important. Um, so grassroots efforts is where it all starts. Again, most of our, man, I think the world would be a better place if all of our lawmakers were physical therapist assistants. Um, Maybe that's not entirely true, but I like to think of it. But I mean, grassroots efforts is where we start to educate. We educate individuals, educate advocacy groups, we educate professional organizations, to raise awareness and push for legislative action. We start to educate our senators and representatives about why this is important because they don't know everything. They barely know anything about physical therapy. So it's up to us to educate them on why is it that they can understand, well, physical therapist assistants need supervision of the physical therapist, but why are you saying we need less supervision? Why is that a thing? Uh, well, we need to raise the education standard of them. We need to educate those people. Other professional organizations. Why is the American Medical Association, the pediatric section of Rhode Island, all pediatricians against this legislation? Well, let's go educate them on why it's important for us, because it's actually different than what they do. And so that's all of the grassroots efforts. Because in this big process, if there's possible hearings, we want to educate those people that might have to be against whatever law we're thinking of, because at least they can see it from our side and maybe they can have a different perspective. All of that is at the grassroots efforts. Nothing gets. You would think even some slam dunk laws just don't get passed for some pretty wacky reasons. Really important to build support and help lawmakers craft the bill to be really, really important things that we can do at the grassroots effort. So in the House, the voting in the House, we could vote it in a few different ways. The voice vote, everybody in favor say aye, everybody opposed say nay. As long as it's clear, okay, fine, yays win or nays. We could also do a division vote. Everybody in favor stand up, everybody in opposition stand up, and then we just count all of those. Teller vote, Sharon appoints the tellers who counts the votes. Recorded votes are usually done electronically. I don't know if anybody's ever watched a vote happen. It's shown on the screen nowadays. If you ever watch C-SPAN or I forget what channel the Rhode Island, the local some channel you need an antenna to see that channel. I don't think it's on cable. But that's voted electronically and you can see that pop up right away. Or we could do a individual roll call, so yay or nay vote. The representative from Foster, what is your vote? Representative from Coventry, what is your vote? Representative from Providence, what is your vote? They just go down the roll each one. I think what I see mostly is the recorded vote, which is done electronically. It's everybody's just got a button now. I think that's the. I shouldn't speak like that. In general, what I see is the voice vote, and then if we need to, the electronic recording of it. So then bills are presented in order on the calendar. Calendars only change with a unanimous vote. How many unanimous votes do you think exists in politics right now? Yeah, none. So once you're on the calendar, you're there, and you're not going to get it changed for any reason. And then senators can only speak twice a day on an issue. Filibustering may occur. There was who just had a 30-hour filibuster just last week. Anyway, so filibustering is basically I'm just going to waste everybody's time so you can't vote on this. It's I think it's well, I'm not a politician, so I shouldn't comment on what I think is good or bad. Um, to delay, to delay. I'm going to take up all your time, and then you can't vote on this because I took up all the time. Yeah, it's just yeah. Um, So both of the House and the Senate must approve the bill before it goes to the president to be assigned. The president can veto it. And the president, if they do agree with it, they have 10 days to sign it. So the president does have to sign it. So at the state, what's it? Off the top of my head, I'm not sure. Oh, there then has to be a majority of the Senate to override, like there is another loophole. I forget exactly what the details are at the federal level. There is a way though. So at the state level is a little bit more what I'm familiar with, because it impacts me and my career and the practice of physical therapy. So it's similar process. We have state representatives, state senate, but the bill goes to the governor instead of the president. Very similar process. A couple of recent activities supporting direct access in Rhode Island. That was an interesting one. Gina Raimondo, in her first governorship, she tried to eliminate PTA licensure in Rhode Island, so no longer requiring licenses. Yeah, you got some good looks there. What would happen if that happened? If you no longer needed a license to practice to be a PTA? Bunch of crappy PTAs. Yeah, you're absolutely right. You're absolutely right. Any other? But yeah, competitive, more people. That's actually what the reason she wanted to eliminate, and it wasn't just PTA licenses; it was licenses for a bunch of different professions, um, like barber. Like there's a bunch of other nail tech. Um, so yeah, her idea was we got to stimulate this economy, and we have all of this licensure that maybe we don't need. Um, we'll dive into that a little bit more. Um, a new one, in addition to PT, being able to order simple imaging, so X-rays. So especially with direct access, what's direct access again? You don't need a referral to go see physical therapy, or I mean, direct access could refer to any provider, but yeah, in physical therapy world, so, I mean, if I've got a patient with an ankle sprain, some of you playing recreation basketball with your buddies, sprain your ankle, come in hobbling 2 days later. If it's tender to touch on the lateral malleolus, difficulty of weight bearing, there's a couple of other rules to it. I should be able to order an X-ray and have a radiologist tell me if this thing is fractured. I shouldn't have to send them back to the doc. So then the doc orders an X-ray, and now the person goes get an X-ray. Like let's make this more streamlined. So I can order simple imaging now in Rhode Island. Others that I didn't put up here because I just started happening. The prior authorization for insurances was a big one. Decreasing that administrative burden is good for patients. Also, copay parity is another one. Well, also, I don't remember if I talk about it here, the PT Compact. If I don't have it up here, I'll remind me and I'll talk about it. So in 2015, Governor Gina Raimondo, this is her first governorship, attempted to abolish licensure requirements for PTAs to promote employment rates in the state. And again, it wasn't just PTAs. There's a lot. It was, off the top of my head, it was somewhere around 20 different licenses, professional licenses. Now, I think PTAs are a little bit different than your barber, but you know, so it didn't pass because of the advocacy efforts of the APTA. The Rhode Island chapter of the APTA worked incredibly hard to change the governor's mind and to protect the license. But the big reason is a lot of public safety concerns that are a little bit different than your nail techs and barber shops. So I wrote that wrong somewhere. got grandfathered into PTAs without me requiring losing licenses. There's something wrong with that sentence. I don't know what I was thinking there. It was very late at night when I wrote this, I guess. Major public safety is if we don't have a license, how do we know that the PTAs are of quality? I don't know what I was writing here. I'm reading this over and over again, and I can't make heads or tails. And I can't place why that. I think I gotta delete that sentence. Yeah, yeah. I don't know. And moving the so delete that one. The second one is really important. PTs and PTAs were concerned that PTAs who couldn't pass the licensure exam would move into Rhode Island. There's also concern if you're working as a PTA in Massachusetts and you get your license suspended, and what are some of the reasons that we saw that licenses get suspended for? Basically fraud and inappropriate sexual conduct, whether it, if it crosses the line into assault or just below into really weird and creepy, right? So somewhere in that gray area. Those are the two main reasons. Others were the guy was drunk at work and hammered, like not I had a beer at lunch, like I had a 12-pack at lunch. Those PTs that had their licenses suspended in other states could come to Rhode Island and just start working. Is that the kind of workforce we want in Rhode Island? No, no. So we would have really poor PTAs and no repercussions to say you can't work. So that was the biggest problem that we had with it. And I mean, a little bit different than a barbershop. We are working with patients dealing with intimate areas of the body in vulnerable conditions. If we were to see a video of somebody teaching somebody how to stand up and sit down with good body mechanics, I am chest to chest with my patients. My patient, the one I worked with earlier today, I mean, his head is right here. We're ear to ear, so I can help him get up. And that's what protects me and it protects him. Well, I don't want somebody who got their license done in another state able to be that close to patients in this state. Other thing that I would worry about is, well, if licensure is not required, does the state college need to have a PTA program? If you want to work in another state, you need this, but the state college worried about the state of Rhode Island, the program would disappear. So all of those were problems. Yeah, I don't know what this bullet point is. Let me delete that one. Rook, did you have something? Did you just raise your hand? No, did anybody? I thought I saw someone raise their hand out of the corner of my eye. No, I made that up. Did you want to say something now that I called on you? No, you're good. Okay. So anyway, I mean, I think when we look at Gina Raimondo, like, I think her initial thoughts were probably in the good place. How do we get more people jobs? That's a very noble thing and something that's good. But again, who's the experts of the profession? Us. What does Gina Raimondo know about the field of physical therapy? Very little, and it was very clear on how little they knew about the field of physical therapy and why that just shouldn't happen. So go back and some of the repercussions if this were to happen. Not only bad PTs moving to Rhode Island, what do you think the pay would be? Kind of what you were going along with, Cam. What do you think? Probably go down a lot. Anybody can be a PTA. There's no reason for it. What do you think insurances would do when they'd say reimbursement, say these people don't have licenses, what do you think they would do? Not pay immediately. We're not going to pay for any care that's done by a PTA, but they're really good and they'd be licensed in other states. What do I care about other states? We're not paying. So it would have been a huge disaster for a lot of different reasons. I want to talk about a few other ones, but public relations and marketing are essential tools for advancing the visibility, credibility, and growth of the PT profession. And going back to the why is grassroots efforts so important? If we can educate the public, influence policy, attract patients, enhance professional opportunities, all of that is going to be good for us in our profession. We have a really high, as far as passing of laws go, and passing of laws is incredibly difficult, and if we wanted to get a law changed, we'd start working on it now in hopes that 4 to 5 years we would have success. Like, it is a very drawn out process. But in the physical therapy world, we have some pretty good success at creating laws because the general public thinks favorably of PT. We do a good job. We do a good job. We have good people working with it. We're caring people, and we do a good job, good enough job, I'll say, with our public relations and marketing. There's a lot of people that like us. So we don't have a lot of anti-PT people out there. Different than the gun lobby. Gun lobby, hot topic. You'll find people that are on either side of that and will never budge in their opinions. In physical therapy, we're generally viewed as good. So we have a good starting point with that. And with other healthcare providers as well. So one of the things in this legislative process is when we have other healthcare providers and heads of other groups say, we support our physical therapists. That's always really good. Whenever I talk to another healthcare provider, I get to talk to a lot. Some of these different courses that I go to, networking events, all of them say, I love this. I love my PTs. They help my patients so much. We take headaches away from them, hopefully. This patient has this pain. They don't know why. These tests are coming back negative, go to PT, and all of a sudden the patient goes back and says, I'm so much better. That's good for us. Some of the areas that we can improve is being the first choice when somebody has musculoskeletal pain. Chiropractor does an excellent job with this. There's a large percentage of the public that if you were to wake up with back pain, you'd call up a chiropractor first. And there's zero reason why physical therapy couldn't be the first choice. I think that chiropractor got a really big head start on the direct access. So that's some decades had decades of head start. I also think there's some ways we can improve as a profession. Chiropractor, man, what do? You go in, you lay down, you get manipulated, you feel a little bit better, and you walk out. Like, it's very passive. Where in physical therapy, we say, geez, it hurts when you go to reach down to the ground. Great, let's reach down to the ground until it doesn't hurt. It's not comfortable. Chiropractic is not all chiropractors. I should not. There's some chiropractors, the ones that I work with and send people to, aren't just lay down, I'll manipulate you and you go home. Like, the best ones that I know incorporates exercise as well. But in general, the more passive you can be, the more popular you're going to be. Not necessarily better, but popular. So I think we in the physical therapy world, we can do a little bit better job listening to our patients. And one of the nicknames I hear from patients is, yeah, what does PT stand for? Pain and torture. I wish you didn't think that. And that's certainly not how I practice. Although there's times in my career where I definitely could have been accused of doing that and not taking enough care to do that. And you see that a lot, like patients don't want to move and we tell them to, and like, keep going, keep going, keep going. And I'm sure you've seen the people that like, I just want to come in and lay down and you do it for me. Yeah. And man, like, it's really tough, especially the empathy I have is really tough when you're in pain to want to do something that also causes some discomfort. Yeah, there's plenty of times I just want to lie down and you do it. Like, you make dinner, I'm just laying here. Like, you do the laundry, I just want to lay here. I mean, we all get like that, right? So I think we have some room to improve, both in how we practice, but also in the marketing of, we should be at your first choice along with chiropractic or any other thing. Like, we're right there. We're just as good as any other, if not better. But I might be biased. What do you got? Yeah, it's a college degree. Last time I looked, an undergraduate degree was not required, like it is with DPT, the Doctor of Physical Therapy. Some colleges do, but it is considered graduate school, although undergraduate degree is not required. So there's only a few different chiropractic schools in the country. I know of one Rhode Island-based chiropractor that's also a PT. And I will say, the couple of chiropractors that I know well do a phenomenal job, and I would trust. And they also give exercise with their patients, and they're not just this come in once a week for the rest of your life type thing. The things I have trouble now you're raising your hand. Is that true now? You're not. Did you fake me out last time? All right, give me 1 second. The chiropractors and this is just purely my opinion, the chiropractors I have a problem with is the ones that say we can cure your asthma by manipulating your spine. Those are the ones I go, I don't believe you. Now, if you're going to say your back hurts and I can manipulate you and you'll feel better, that I 100%, I do spinal manipulations. That is part of the Physical Therapist Practice Act, and I haven't done it in a long time, but at one point I was pretty damn good at it, and I saw a lot of good relief. But yeah, when you start getting into that more abstract, I just like the chiropractors I refer to don't practice in that. So, but there's to press stop on the recording. There's also bad PTs out there. There's also PTs out there that are going through the motions and aren't working as hard as they might be able to. So, but now back to you, Rook.
I was wondering what their scope of practice is. Like you said, that you can have spinal manipulations. Like, what do they do that is so different? You know what I mean? Like, are they just manipulation? And then I know you said some can have exercises. I just am kind of curious why you go to that versus.
All right, so you had a couple of questions there. The scope of practice for chiropractors versus the scope of practice of PT.
Yeah.
There's a lot of overlap.
Yeah.
And a lot of it has to do with just how they started their profession and their advocacy groups, and they created these laws of direct access way early. They call themselves doctors way earlier than other professions, and it just kind of snowballed from there. So each state has its own practice act on what chiropractors can and can't do. I think Rhode Island is pretty broad, but I'm not exactly sure on that. They can order imaging and they can read x-rays, and they're looking at more alignment of the spine rather than this is a fracture or this is a tumor type thing. So, but they do have some imaging, ordering, and reading. They, as far as I know, can't write notes to keep you out of work or different things with insurances. Like there's limitations on that kind of stuff. So that was your first question. You had another question within that.
I think just like if you can do spinal manipulation as yourself, you know, like where did you end in the maybe yeah.
Oh yeah. So why would a patient choose chiropractor versus PT? I have shared patients. I have told patients I think you could use a chiropractor, And it's because what I'm doing, we're not getting over the hump. And I just feel like I'm doing a good job, but somebody that does this all day, every day might have a little bit more success. So yeah, that's a great question. Why would a PT send someone to a chiropractor? And it's for the benefit of the patient. If you think it's going to benefit the patient, let's go. And that's why I find good chiropractors to work with. And I hope they find good physical therapists to work with too, because they shouldn't know everything. They don't know everything either. And at one point, I had a chiropractor as my number one referral source. So, um, yeah, I think good people should always work together. Yeah, I don't have a perfect, this is exactly when to go to a chiropractor versus this is exactly when to go to PT. There's a lot of overlap, just like OT versus PT. There's so much overlap that we have to just make the best decisions possible. Yeah. Yeah. Yeah, or have a higher level of skill. I will also say, because I don't believe in the spinal manipulation cure asthma type thought process, when I think someone needs that type of thought process or something more abstract, like I'm gonna use someone else's expertise. Um, I can give advice on nutrition, eat less fat, stay away from sugar, but I'm not going to give you a meal plan. I'm not, and that's now you need to go somewhere else. Or if you have a special condition, um, if my patient's on blood thinners, they have to be really careful with leafy vegetables and with citrus, because both of those interact with the medications either to limit the blood thinning effect or to amplify it. That's the kind of stuff I'm going to talk about my patients. My patient has uncontrolled diabetes. I am not the person to fix that. So that's where like nutrition, where like some patients I need that dietitian and others don't need it. They just need someone to say, with me in their home. I see a salad in the fridge. That's not yours, right? Because you're on a blood thinner. Did you know that this would be an interaction? That's a problem. Yeah, so there's a little difference. And with chiropractor, there's a lot of that too. So sometimes it's I'll also tell you this, I do not do upper cervical spinal manipulations. And if I find a patient that I think could really benefit from it, I'm going to give you to a chiropractor that's going to do that more. Um, that is one area that I just am going to walk away from. I refuse to do it on pregnant women. There's some chiropractors out there that would feel okay with that. So I think to me that's too much of a risk. Man, if this patient's not responding to my treatment, let me guide them into someone who will take that risk on. So those are a couple reasons why I would send someone to a chiropractor. And yeah, and sometimes it's just I had one patient, he was like 6'7", not a skinny guy, not super obese, but not a skinny guy. And just like it was physically like I really thought he needed some manipulation of his spine, and I just physically couldn't manage my body to their body to get the effect that we needed. And I think the chiropractors were a little bit better with it. They also have some different tools, like a drop table, that instead of like me exerting the force, they position the patient. The table drops 3 inches to provide that force. So they've got some other tools there that I just don't have. So those are some reasons. So you sent to a chiropractor. Um, there's also on the other side of the coin, back to the legislative process. Um, in the physical therapy world, we advocate for our own profession. Chiropractic likes to try to nip away at our practice act. These are the things we do. You should do it. And spinal manipulation was a big one that we added to our practice act. Chiropractors did not want that to happen because that's they're trying to protect theirs. One of the reasons we were able to get it is because in chiropractic schools are not required to have an undergraduate degree, and in physical therapy we are. So we have a higher standard of education in the physical therapy world than they do in the chiropractic. And that's why, one of the ultimate reasons why it was voted favorably for us. And usually when there's a head-to-head and we come out ahead, one of the reasons is because of that, that education requirement, so. All right, do we have any questions on this stuff? It was on the, compact, PT compact, another law. Two other laws that were just impacted, in Rhode Island. So the PT compact is, did we talk about this before? I think we'll talk about it again, not next week, but in 2 weeks. But this legislation was just enacted in Rhode Island. The PT compact means you no longer have to get a new license for every single state that you want to practice in. So in Rhode Island, really, really beneficial because we are anywhere in Rhode Island, you're 20 minutes away from a border. So I could start practicing in Massachusetts without getting a Massachusetts license. And it makes things a lot more efficient for us. Now, each state still does have laws to it. You still have to if the state has a Practice Act quiz or exam, you still have to take that. Like there are still hurdles you have to jump through, but I don't have to apply for a new license. What used to happen, this is what happened to me when I got a Massachusetts license, and I had to apply for a whole new license. So then I had two different licenses. With the PT compact, I can just have my Rhode Island license and I can work anywhere that there's a dark blue shade to. I just have to, if I want to go to Tennessee, I have to look up their laws and say, okay. What did I think? Tennessee?
Yeah.
So Tennessee, I would have to pay $200. What's this other fee? Commission compact fee. All right. So total would be $240, and I have to pass the Tennessee jurisprudence requirement course within 30 days of getting that. That's all I got to do to start working in Texas. Where before this PT compact started up, I would have to apply to the state of Tennessee for a license, give them my original transcripts back from URI. I need both undergrad and grad school. I also have to give them my licensure exam that I passed. So I have to call up FSBPT and say, hey, I took this exam 15 years ago. I need proof that I took it and passed it. So then I have to get that. I have to send that all. I also have to take the jurisprudence. I also have to pay the state of Tennessee. And then they have to process that paperwork for a month or two. Well, if I'm a travel PT and I only want to go there for 13 weeks and the job starts next week because it just opened up, I need to get this going. So the PT compact makes it all so much faster and so much easier. As long as you have an active license in one of the compact states, great. Give us our money, pass our state tests, and get to work. So it's much more streamlined, especially for the travel PTs and PTAs. Just to move to a different state can also help. And then the border areas, like all of Rhode Island is a border town, but there are some towns. Texarkana is a famous border town where it's half in Texas, half in Arkansas. There's a handful of other states that have Kansas City is another one. So anyway, that's the PT compact. There's one other one that just passed. What was I thinking of? Oh, I'm blanking on all of the details, but there's a section of time where you get to work as a graduate physical therapist assistant. So as long as you graduated from school, you can start working as a GPTA and you haven't sat for your licensure exam. The old law said as soon as you fail, if you fail your exam, your GPTA status is revoked and you can't work it. A lot of pressure for somebody that's taking that exam. Most other healthcare providers allow a certain number of failures. So they have similar graduate OT, right? So a lot of other healthcare fields, professions allow you to fail the exam as long as you're scheduled to retake it and you still have supervision. So we enacted that law in Rhode Island. And that gives a lot of breathing room for our graduates that want to start working. You paid all this money for tuition and you want to start working and getting paid to do so. It gives a little bit of breathing room and puts us on par with other healthcare professions that have similar standards. So that was another law. And all of that is done because of grassroots efforts and the APTA. And the local APTA saying, we want to do this. Here's how we're going to start doing it. We're going to start working on it now because in 4 to 5 years, we hope to have the positive outcome. So another reason why the APTA is so important. All right, let's go back to our learning objectives. Why must PTs and PTAs be involved in the legislative process?
Sounds like the politicians they know the profession.
Yeah, so we can educate the politicians on our profession. Yeah, yeah. Why else? Protect the Practice Act. Yeah, if personal training wants to come in and say, we want this, but it's part of ours, then we've got to be able to protect our Practice Act. Yep, what else? A good example of that is use of modalities with wound healing. There's some modalities that only we as physical therapists and physical therapist assistants can apply to patients. It's within our Practice Act because we have education on exactly how to use it. I just taught it yesterday. We don't want nursing who does a lot of wound care to come in and say, well, we want to be able to do. Okay, well, what's your education on this? Is it in your Practice Act or not? Is this actually good for the public to have somebody who's not trained on these things starting to try to take it? How would that weaken our Practice Act and our profession? So anyway, yeah, so protect the Practice Act. So we are the experts, so we need to educate our lawmakers. We want to protect our Practice Act. Any other major ways why it's important? One last way. Advocate for the patients is the last one. Yeah, making sure we can advocate for our patients, and and not only in physical therapy, direct physical therapy related matters, but in other health related matters as well. Should we have biking paths and walking paths for the general public? Well, more movement is good, and if 25% of Americans are going to die because of some cardiovascular related illness, what's one way we can take a little bite out of that and make that a little bit better? Process to develop laws initiated at the grassroots level. A little complicated. Who can give some broad strokes to it? Yeah. So it starts at the grassroots level to educate the lawmakers. Hey, we're thinking about doing this. Here's a problem within our profession. Here's the thing that we think would help us out with it. So it starts with just education, and especially education of lawmakers, education of other advocacy groups, maybe other healthcare professions. And then we help get a bill written. The bill then gets put to a committee and subcommittee for a whole bunch of meetings and markups and editings, and then it gets voted on, yes or no. And then it climbs back the ladder. So then it gets voted on, should we, yes, and then the committee says, we good with this, yes, and then it goes to the bigger branch to then get voted on. And then yeah, grassroots is where it starts, yeah, yep. Different types of legislation, there are 4 different types of legislation. Bill, joint resolution, concurrent resolution, and then just resolution. Starting from bill is the strongest, and that is a law. That's exactly what our goals are. All the way down to resolution. Resolution, hey, October physical therapy month. Ceremonial, it's great. October is physical therapy month. Yeah, it's just, yeah, kind of just like a declaration. So good. Need for public relations and marketing to support the profession. Yeah, keep business. Yeah, we need patience. Yeah, so that's good. It also, in this topic, it directly impacts the grassroots levels to help change our profession and to strengthen the profession. So, all right, any questions on this stuff? All right, let me press stop here.